Hi, everybody. I'm here to talk to you about healthcare services. So let's get started on that. All right. Okay, so this is chapter 9, and there are a couple of different models of health. And I gave you a video on the wellness model and kind of what that means, because I think that we are used to considering the sickness model pretty instinctually. Um, we basically think about going to the doctor and the doctor tells us what's wrong and then they give us medication and that's that. And the wellness model is a little more complicated than that. It emphasizes what's going right. It's much more applicable when we're talking about mental health, for example, than when we're talking about pure medical conditions, but not exclusively. So it really does focus on that strengths-based perspective, which is why I gave you an entire video on it and 5 points worth of essay question on this week's quiz. So make sure that you check that out. Okay, so the American healthcare system is basically an employment-based system. So most people get their health insurance through their job. Um, there are other health plan alternatives that are provided by the government. They're at this exact moment Medicare and Medicaid. In California, Medicaid is called Medi-Cal, so you might not be familiar with the term Medicaid, but it is the same thing. Medicare is basically for people who are eligible for Social Security, so mainly older people, but also people with disabilities and a couple of other things. But Medicaid is coverage for folks who are low income. So, in theory, if you are not able to have employment-based care, you are going to be covered by Medicaid or Medicare. Is that true? No, it is not. But we also have the ACA, which we're going to discuss. So the ACA, it a little bit of history here. It was really intended to be a much bigger program than it is. And over the years, there have been various legal challenges that have actually made it a smaller program than it initially was. And the plan originally was to make sure that everybody was covered and in an affordable way. Um, it has expanded coverage significantly, but not everybody is covered. You should definitely become conversant in what the Affordable Care Act is, but that is beyond the scope of today's lecture. So the most important things about it, from our perspective, is that it banned exclusions for pre-existing conditions. So previously, before the ACA, if you had an established medical problem, you were going to have a real hard time getting new insurance. So like, let's say your employment ended at one place and you were trying to get on the insurance at another place and you had a pre-existing condition. Often the new insurer would not insure that condition. So you were effectively without coverage for something that you knew was a problem. So the ACA has banned that, which is fabulous. And it's also allowed children to stay on their parents' insurance until 26, which was, not previously insurance sometimes covered you into adulthood, and you could stay on your parents' insurance, but not necessarily. So those are great. There are a couple of different types of health insurance plans. I'm kind of going to speed through these a little bit, but basically, fee for service is, you choose a doctor and you get your services, and then the insurance companies just sort of like takes care of it. But you have your copay or whatever, but you get to choose where you want to go, who you want to pay for, that sort of thing. Fee for service, not as common as say managed care or HMO. or I'm sorry, PPO or HMO. So basically, managed care, that would be your HMO, that would be your PPO, and basically they're both designed to make sure that you don't access more care than you need, so that you can keep your costs down. So an HMO. So what an HMO does is you select a physician, and it is their job to determine what care it is that you need. So if you go to your doctor and you say, my foot hurts, it's before you can go to the podiatrist, your primary care physician is going to have to make sure that you get a referral for that. And the way that makes things cheaper is that sometimes you go to the doctor and you say, my foot hurts, and he squeezes your foot, and he determines that whatever it is something that he knows what it is and how to fix it, and so you don't actually need a specialist. Whereas if you were picking, you would just be like, well, my foot hurts, so I need to go to a podiatrist, who costs more than a primary care physician. So that's how you can reduce costs that way. PPOs, they are a network, and basically you get to pick from the network. If you don't pick from the network, it's not that you're not covered necessarily, it's that you're covered at a lower rate. So maybe your copay would have been 10% before, and now your copay is 50%. So it's you kind of trade off the extra choice that you get and who you choose for essentially higher out of pocket costs, most likely higher out of pocket costs. So there are some real limitations in the healthcare system. I'm sure that you are familiar with at least some of these, but basically, from any other developed nation, we spend more on healthcare than anybody else. So, and also our general health is just not as good. So, what is that about? So basically, it comes down to two things. It comes down to the cost of healthcare in our country is going up, and like we are not paying a whole lot of attention to prevention, whereas other countries are paying a whole lot more attention to prevention, which by and large is much cheaper than to prevent than to react. So the rises in our costs are about the prices of care. So how much it costs to see a doctor, how much it costs to get a medication, that sort of thing, and how much technology we use. So, we, for example, use much more MRI in this country than they do in other countries, and those technologies are very expensive. So, so it comes down to basically those things. Despite the ACA, lots of Americans still don't have health insurance for various reasons. But basically, for most people, even getting insurance through the exchange is going to cost a good amount of money. Like I said, it's not a perfect law. So underinsured is also a really big deal. So, you have insurance, but it doesn't cover you very well. For example, it's just catastrophic. So like it doesn't cover you for really much of anything unless, you are actively bleeding or something like that, right? So being underinsured is also a big deal. And, when you are not insured or when you're underinsured, chances are that you are not that you're kind of on the lower end of the income scale, and what that can end up doing is forcing you to choose between medical care and other things. So rent, for example, if you really need care, you might have to make that choice. And then there's another problem where sometimes if you are really underinsured or not insured at all, that you go to the emergency room for basically everything that you need. And then you end up with these big bills that you can't pay, and then you end up with a lot of debt. It's really quite messy. Okay, so let's talk about some specifics here. So um, we've talked about disability before. I added a little note on this slide to remember to use the language that your client chooses for themselves, and it certainly might not be disabled. Um, but the point of this slide is actually that there's like, I think, 350 million people in this country, I believe. And more than 44 million of them have disabilities that limit their daily functioning. So that's a pretty large proportion of our population. So, we have to really attend to this issue when we think about medical social work in general. And the ADA has been around for decades, and gets tweaked here and there. But basically, what it does is it protects people with disabilities from discrimination. Like, for example, you see the designated parking spots, you see the ramps, that sort of thing. Like, that's all stuff that's required by the ADA. I mean, there are many other things. The where you get testing accommodations or something else. So that's all ADA. ADA is huge. I mean, there's so many different parts to it. Okay, so developmental disabilities is a subcategory of disability. It's defined as a severe and chronic disability that has something to do with a impairment that manifests itself in childhood and doesn't have can't be cured. Doesn't have an end to it. Here's some examples of what that might be. Okay, so worldwide, about 37 million people live with HIV/AIDS. This number, it's not 100% clear because it's very easy to have it and not know. So it's not exactly clear how many folks, but like I said, or like it says on the slide here, 40% of people are not aware of their HIV/AIDS status. It it is decreasing the lethality of HIV/AIDS because we have really strong medications for it now. It has become largely a chronic illness. It does absolutely still kill. However, it is not like the kind of shortish term death sentence that it was 30 years ago. Okay, so just want to pause here on the marijuana slide. The research about what marijuana is useful for and what it actually does for us in a medical sense is ongoing. It's fairly new. The field is expanding, but it's like not a huge deep field quite yet. So the evidence is kind of in progress. That being said, CCSS has a cannabis studies program with cannabis studies classes. And if you're interested in this, I highly suggest that you check that out. Okay, so diabetes, big deal. This is a little bit related. The numbers around diabetes are a little bit related to our numbers around obesity, which are some of the worst in the world. And it is it's kind of an epidemic for us. Okay, so what are the roles that you can play as a social worker in healthcare settings? Basically, it comes down to these four. Pretty much everything falls into one of these. We're talking about acute care, which is basically hospitals and, short stays and inpatient and that sort of thing. And ambulatory care is the largest kind of category of this. It's pretty much everything that is out in the world and doesn't necessarily have folks who are in a facility of any kind necessarily. Long-term care, so we're talking here about like supportive senior care, the facilities that care for people who are ill enough that they can't care for themselves but don't need to be in hospitals, that sort of thing. I added hospice care because hospice is complicated. It could be part of long-term care, it could be part of acute care, but it also is something that you can receive at home. Hospice care, of course, is what cares for people in the last anticipated last 6 months of their lives, and that is a ever growing category of social work practice. That's actually something that I do right now as well. Okay. So values and ethics in healthcare systems are from our perspective as social workers, we view healthcare as something that's a universal right. So it's sort of our obligation to argue for universal healthcare, and to abolish this sort of like, you only get healthcare if you can afford it or if you have the right job or anything like that. And we really should be advocating that pretty much everybody has access to services and in an equitable manner, and that we get to make decisions about the kind of care that we receive and where we receive it and how we receive it and all of that. And it's really important to remember that we really need to take a wellness view of healthcare. So that's that mutual and informed partnership, right? And takes it one more step further into leveraging what your strengths are to help you manage your health. So, for example, if you are a highly organized person, then you can leverage that strength that you have to manage your own medications, manage your own appointments, that sort of thing, even if they're complex, right? So the other thing is that we need to remember that from our perspective as social workers, care is based on a psychosocial framework. So what does that mean? I went right back to the source of where this term came from, and basically where it came from is the well, actually, you know what? I think I'm just going to read it to you. To provide a basis for understanding the determinants of disease and arriving at rational treatments and patterns of healthcare, a medical model must also take into account the patient, the social context in which he lives, and the complementary system devised by society to deal with the disruptive effects of illness. That is, the physician role in the healthcare system. This requires a biopsychosocial model. So that basically is the summary of what it is. Okay, so that is today's lecture. We have quite a few videos this week. There is almost 2 hours on HIPAA. So make sure that you watch those. They absolutely will appear on the exam. There is also, like I said, that fairly short video, I think it's about 10 minutes long, on the wellness model. So as always, if you have any questions at all, please do let me know. I am available at office hours, and you can always send me a message as well. So thank you very much, and I will talk to you soon. Thanks.